We finally have hit June, and the weather on cue is turning better. So lots of us are going to be out and about, involved in a lot of outdoor activities.
Sure are. So I say that's the perfect timing to have Onondaga County Health Commissioner Dr. Katie Anderson stop by for a visit. Good to see you as always. Thanks for being here. We have hit this before, but I don't think we can stress it enough. We're likely in for maybe one of the worst tick seasons ever out there. Is there something we can do to try and prevent exposure in the first place?
Yeah, that's an important question. So you're right, summer's finally here, and we at the health department are getting ready to head into what is our busiest season every year. But you're right, this has been a wet spring. It could be a bad tick season, and there are things people can do and that they should do. We live in a hot spot, unfortunately, for tick-borne diseases. And we know that the deer ticks, there's surveillance that's done in our area. In some parts of our county and in our region, up to 1 in 2 or 50% of the ticks carry Lyme disease. They also carry other diseases. So this is an important public health issue. Things that people can do to keep themselves and their kids safe. One is before you're going out, you can prepare yourself by wearing pants tucked into your socks. Not the most fashionable thing, but prevents the ticks from kind of crawling up your legs and feeding on you. DEET and picaridin at about 10 to 20% concentration are very effective, but you need to pay attention to when you need to reapply it because it only lasts a couple hours. And the last thing is to wear light-colored clothing because these ticks are tiny. Deer ticks can be the size of a poppy seed when they're babies. Right now we have some babies out there. When they're adults, they're the size of a sesame seed. So wearing light-colored clothing helps you identify and pluck them off. The other thing people can be thinking about is when you're out hiking or outdoors to stay away from areas where there's high grass or brush or piles of dead leaves, for example, because that's where ticks like to hang out. And the same goes for your yard, as we're all starting to get into our gardening finally with the sun coming out.
Gotcha. Also hanging out in the yard are mosquitoes. So what should we be doing to reduce the mosquito population? And there's concerns there with
also a problem in this area. So as we all remember, last year was a relatively big year in New York State for eastern equine encephalitis and other diseases that our local mosquitoes can carry. DEET and picaridin protect against ticks and mosquitoes, so when you're outdoors, you're getting double duty from those. An important thing for us to be thinking about, particularly around our homes, is that mosquitoes like to breed in standing water. So about every 7 days, emptying the bird bath, making sure there's no plastic, wheelbarrows, other things that mosquitoes could be laying their larvae in. And if you're out in your yard, you can look for them. They look like tiny little tadpoles. But if you empty the water every 7 days, that prevents the breeding sites.
Okay, so I think that's the first maybe I've heard of that, because I've always heard don't let any standing water around, but as long as you're kind of turning that over on a fairly regular basis, you should be in good shape.
That's right, that helps.
Not to jump back on you with ticks, but how important are tick checks? Because you can do all those things you talked about, but if you're just maybe hanging out in the yard and stuff with the kids or yourself, I mean, how important are doing those tick checks regardless of what you're doing outside?
Yeah, so we know from our surveillance, and surveillance being done at Upstate with other partners, that areas where you have to be careful are places like our state parks, but also your backyard, because we have deer, we have mice, we have ticks in our backyards. So daily tick checks for you, your dogs, your kids, and you want to be looking at places like your hairline, behind your ears, or places where your clothing may be more tight, like your waistline, because that's where the ticks may be crawling up and pause and get stuck. When you find one, you want to remove it by taking a tweezer close to your skin and pulling out at the head. And as we've talked about, there are places you can send your tick here, like the Upstate Tick Lab, where for a reduced fee for Onondaga County residents, they can identify it and test it for infectious diseases. That's important because if you find a tick on you and it's a deer tick that is plump, like it's fed on blood, you may want to get prophylaxis. So if you pull it off within 3 days and get in contact with your primary care provider, they may give you antibiotics.
Okay.
Especially we have to check our children too, not just ourselves.
That's important.
As well. Yeah. All right. So let's talk about, it's now warmer. People want to get in and around the water. What kind of advice would you like to remind people about as we start to get back around the water? Lakes, pools, all of that.
That's an important question. We've been eager to get out there.
Oh, so eager.
So the health department is very active throughout the summer, checking on the safety of our beaches, the lakes in terms of E. coli levels, harmful algal blooms, maybe in our future again. So watch for those alerts. But one of the main things I want to emphasize in terms of things that people should be aware of is that drowning is the #1 cause of death in kids age 1 to 4, and the second in kids who are older than 5. So it's really important that when kids are playing in the water, people are being vigilant and identifying a water watcher, so someone who's not going to be reading a book on their phone and is watching the kids, and also to emphasize that swimming lessons can save lives. Even if there's a water watcher. And there are places like in the city of Syracuse where residents can get swimming lessons for reduced fees.
And no CPR, too.
Oh,
that's also important.
Yeah, very good one. Easy to do. How concerned are you still about I know you mentioned the algal blooms there, but is that still a very serious concern for us around here, or does it kind of depend on the season and the year we're having?
Yeah, so it typically takes a little while. We need to have the water be warm for a period of time that kind of promotes the algae growing and blooming. So that's often more of a July, August thing.
Okay.
But it is something that people need to be watching for. And we can't watch. The blooms come up at different parts of lakes unpredictably. So we're watching for it, but the public is also watching for it. And if people see things that look concerning, like blue or green algae floating on top of the water, they should let us know. They should also keep themselves and their pets away from it, because you don't want to be having that come in contact with your skin, swallowing it, or breathing it in.
All right, we're seeing the wildfire smoke again from Canada. Any health concerns to watch out for?
It's definitely something to watch. We're all remembering 2 years ago when the air quality was really bad. It was a health problem for everybody. Right now, the air quality is good today. The air looks a little cloudy and smoky, but it doesn't smell like smoke. If you monitor something like the PM 2.5, which we can all look up on websites or on the weather app on our phone, that checks the level of that every day. Typically, where we start to get concerned is when the PM 2.5 gets above 100. And that's when people who are more sensitive, people who have asthma, older individuals, may want to stay indoors. 2 years ago, it was up in the 200s, 300s, much, much higher. If and when we get to that point, and I hope we don't this week, I know we all hope we won't get to that point this week, a simple thing you could do is just stay indoors. Don't exercise outdoors, close the windows, run the air conditioning.
Dr. Katie Anderson, thanks for stopping by. Good, helpful tips there. We'll have
a lot of topics today. Thank you.
We'll see you soon.